shime waza work? What's the effect, the physiological effect? There are two main effects that were discussed very often. This is air, and this is blood. This is, of course, a little bit of a simplification. First, the air, the trachea. Trachea. Somebody must translate, maybe. Yeah, yeah. It's very strong. Yeah? So you cannot really compress it so that it's closed. Yeah, but you can do something else. Somebody now must explain and translate maybe into Swedish, because I cannot explain it really in English. Wo ist Elisabeth? Ja. Es gibt den Schluckreflex. Wenn wir schlucken, dann drücken wir das Essen, die Speise, gegen den Daumen. Und dann gibt es einen Reflex, die Epiglottis, der Kehldeckel, verschließt mit einem Röhre, sodass während wir schlucken, dass die Speisen in die Speiseröhren kommen und nicht in die Luftröhre.
Man har ju spänningsreflexen så när det trycker emot så stänger ju luftstrupen. Så att när du ska svälja någonting så ska det ju gå in i matstrupen och inte i luftstrupen. Så genom reflexen så kommer du att stänga luftstrupen.
Ja.
Ja.
Exactly. And we can just provozieren. We can provoke that if we take our finger and press it here. And then maybe wir schlucken etwas. Gleichzeitig währenddessen versuchen wir einmal mit der Nase oder mit dem Mund zu atmen.
Försök att trycka och så andas samtidigt. Och då kommer jag automatiskt vilja svälja. Ja.
Funktioniert nicht, ne? Funktioniert nicht. Das ist der Trick. So, und jetzt ist die Frage, können wir mit einer Würgetechnik genau dieses provozieren?
Det förstod du nu, ja. Man kan producera fram.
Wir wissen, wir haben die Würgetechnik, we know we have the shime waza and Katame no kata in situations that are completely unrealistic. So we use it for a different purpose. Okay? So the didactic purpose of shime waza and Katame no kata for me is to explain how to strangle the most effective way. Yeah? And from behind, I do not try to pull against Kehlkopf, pull against here. But I try. Yeah, but I try to. This swallow reflex. Yeah. So my finger goes down here and pushes a little bit up, and my head pushes a little bit down, and you feel you cannot breathe anymore. Yeah. So this is basically what happens. So I push up, and of course when the head is pushed down, yeah, it compresses. So I'm behind. Okay. So if you manage to turn his head, he can escape. So my head is close to his head to block the head. My hand is here, and I'm ready to push against his above the Adam's apple. Here, and then I move back, and my shoulder pushes his head to the front. Here they are. That's it. Yeah, extremely fast. Yeah, and you cannot breathe. It's impossible. I move him a little bit backward and balance him, and while moving backward, my shoulder pushes forward. So this is the effect. Yeah? And here, man. Okay. In Katame no Kata, he tries to defend with both hands. He tries to catch my arm, and maybe tries to twist his head. But this is not so important now. Yeah? And I really want you to be precise. Here, the hand is on the shoulder. I'm here, and up there, I pull back, and with my shoulder, I push for over. Exactly. It's super quick. Yeah, and it produces a lot of stress. Yeah, and not very much pain. But the pain we have when I have the arms after this is pain. Yeah, maybe you could not see the difference, but it was extremely. Yeah, it's a huge difference. Pushing against the arms after can destroy the structure. Can be very very dangerous. Yeah, and it's painful, but you still can breathe. Here, you cannot breathe. Yeah. Okay. So the correct way of doing it in Katame no Kata is I approach here, here, a little bit back, and give him back. Yeah. So please focus on the correct strangling and check if we cannot breathe. Thank you.
Now it's about the relevance of this way of doing. When you strangle from behind, yeah, it's a good idea not only to pull, but also to push a little bit from underneath. Also hier in den Zungengrund schieben. Ja? Und gleichzeitig den Kopf. Ne? Zum Beispiel, in die Bauchlage, Bauch. Okay, so, ich will jetzt hier würgen, ja, und sehr oft sehen wir, dass die Leute hier ziehen und ziehen und ziehen. Ja? Ja? Also sie ziehen so, aber wenn ich jetzt mein Handgelenk drehe, sodass ich hier mit in den Zungengrund drücken kann und mich in meinem Körper auf seinen Hinterkopf lege, then I have this effect. Yeah? So I'm here, and du merkst es, ne? Yeah? So it's you don't need any power. Yeah? It's just from here like this, and well, here we are, and some pressure on the head. Yeah? And if I only pull and do not put pressure on the head, nothing happens. Now here we are. Yeah? So please try to implement this little thing in this very common situation of waza. Yeah? Okay, please try. About one little detail, how to make almost every strangling technique, almost every shime waza more effective. If you keep in mind that it's not only around pulling something in a horizontal way, but also pushing up something here and bringing the head down. This is an extra. Yeah. This is the extra effect. Yeah? So you must try to combine it. Yeah? And harakajime is the model technique for it. Yeah? But also okuri erijime. So usually it is explained okuri erijime. We pull to this side and pull down. Yeah, it works a little bit. Yeah, but if I now turn my wrist a little bit to give the pressure up and push his head down. Yeah, so from here nothing very much happens, but this changes everything. Yeah. So when you strangle, also we have the kata hajime. So until here, maybe nothing very interesting happens, but now I twist a little bit, push forward, and it makes it more effective. This is how to use this swallow reflex for the shime waza. And once you understood this concept, yeah, and you think, okay, I'm here, I do not have to pull somewhere. Of course, it works sometimes. It uses pain and it has some effect, but you can make almost every shime waza more effective when you're here. All shime waza from behind. Yeah? From behind, because from behind you can push down. So this is also, yeah, from behind. I was doing it from the side, but Pernilla, you were doing it from the front. Yeah, makes no difference. I can. This is, yeah. I must, yeah. Simply, my hand pushes up here, this direction, and down here. Yeah. So I back. That's it. Yeah, basically, and I can use, of course, my body. Yeah, I can pull to the side now. Nothing really happens, but I change the direction, and he's giving up. Okay? Just a minor tweak, and all you need to understand is the effect of the Schluck reflex, swallow reflex. It's called. Yeah. So again, please do every shime waza you want to know, every shime waza from behind you know, and try to implement this idea and to make it more effective. Yeah, for some minutes, and then we proceed to strangling from the front. One little remark: the way I did okuri eri jime and kata hajime was not the standard and not the complete way of doing it in Katame no kata. Yeah, I just wanted to put this extra element, what we learn from harakajime, to the others. Yeah, after the next after the coffee, we make a coffee break. No coffee break anymore. We finish earlier. So the coffee break is after we finish. Yeah. This is the idea. but later I will show you with Julia the correct way of doing it in Katame no kata. Yeah? But you realize the relevance of this effect. Yeah? And please think of all your strength in runnery when you strangle somebody and it's hard. Please remember this direction, and it will work. Yeah? Now strangling from the front, and the effect is on the blood. And I had the very, very special experience when I was 17 to see Opa Schutte. Has anybody of you heard the name of Opa Schutte? Has anybody of you had the pleasure to yeah. He passed away in 78. So the last year he was teaching, I had the pleasure from him. And he did Gyaku Juji Jime. He explained Gyaku Juji Jime. And he strangled 4 persons in a row with Gyaku Juji Jime. He told them, if you feel anything, yeah, please tap. And none of he was explaining something, and are you still there? Yes, I'm still there. He was talking with them, and then they fell asleep without anything. And the 5th, he tapped, and Opa was so surprised, and said, "Hey, but you didn't feel anything." "No, I didn't feel anything." "But why did you tap?" And the answer was, "Because you did it already last year with me." what did you do? So I cannot do it, but I know what is happening. So you don't we could talk, yeah. And yes, as Opa was talking a little bit, and you will feel something and you will tap, yeah. But you don't have problems with air pressure, with air. You can breathe, yeah, yeah. But it's getting a little bit dark now, a little bit dark, and we would wait a little bit longer, and then it's now you will tap. Yes. So it's a completely different.
The blood pressure goes down in your head.
Yeah, the blood pressure goes down slowly and gradually. So why? Do we have a doctor here who can explain it? Yeah, we have some. There's a carotis sinus, is there? Carotis sinus is a sensor in the aorta and measures the blood pressure. And this is an alarm sensor. If the blood pressure is too high, then the brain is in danger to get a stroke. Yeah? And the effect is if it's alarm from the sensor that the blood pressure and the heart rate goes down. So in medicine, it is common if somebody has a very high heart rate, they touch it from outside and they simulate from outside too high blood pressure. Yeah, because it's compressed a little bit. Yeah, and when it's compressed a little bit, then the pressure is higher, and then you have the alarm signal, and the heart rate goes down, and the blood pressure goes down, yeah, and then it's going to be. And I'm sure that Opa, he was a dentist, over 70-year-old dentist, so he knew exactly the anatomy, and he knew exactly where to push. And I've never seen anybody else who is capable of doing it. But please feel your blood, yeah, and now increase a little bit of the pressure, and you feel that something happens. You feel it in your eyes. You can sense it, yeah. So blood pressure goes down, and it takes a while, yeah. And this is the other effect. Of course, shime waza is of pain, of panic, air, and blood pressure. And we never know why somebody taps. Yeah? And for us in competition, if it's panic or pain or blood pressure, we don't care. Yeah? But when it comes to correct shime waza, yeah, we should know about the physiological effect and do it as precise as possible. So the point for carotis sinus is exactly here where we feel our heart, and maybe 1 centimeter down we have the carotis sinus. A little bit to the Adamsapfel, and we can feel it from outside. There were some experiment for this effect, not with Judo people, with other people. So they had special special apparatur, yeah, apparat with air, mit Luftkissen. Ja. Und das hat man 10 Sekunden. Ein paar Sekunden, ich weiß nicht genau, 10 oder Sekunden, gehalten, und dann hat man den Blutdruck gemessen. Ja. Und dann geschaut, wie viel es ist. Ja. Und there were also some experiments with, this is a very sad thing, with mentally ill people, and they used not 10 seconds but 100 seconds. Yeah, it was the time when mentally ill people were treated differently, so if they die, who cares? Such experiments were done in several countries. Germany is famous for such experiments, but it was not Germany. It was United States of America where they made these kind of experiments in the 40s. Yeah. So from these experiments we know, from other experiments we know how long you can survive in cold water. Yeah. And other experiments about the effect of shime waza are very problematic because nobody makes an experiment until people are unconscious. They make experiments until people tap. Yeah? And there's in one of the magazines of IGF, there's an article about these experiments. Several experiments are mentioned with the results. But the problem is the variation of the shime waza is not mentioned. So it's juji shime. Which juji shime? Who has done the strangling? Yes, it's strangling by black belts. Okay. Was it somebody like Opa Schutte? Or was it somebody like who didn't know exactly? Yeah. So from these experiments, we do not have precise results. Yeah. So for shime waza, gyakujuji shime, you should have as a result reduced blood pressure and reduced heart rate. But sometimes in the experiments, they had the opposite result because of panic. If I cause panic, the heart rate goes up, the blood pressure goes up. And if I have the carotid sinus, yeah, you didn't have panic, I'm sure blood pressure and heart rate went down. Yeah? So we know about these effects, but the experiments, the results were not really eindeutig. Yeah.
When you compete as a veteran from 60 and up in age,
Yeah.
you are not allowed to do
Shime waza, yeah.
Is it because of this blood pressure that's falling?
Yeah. I was talking about this with a good friend. He's a doctor, and he said older people, it can be dangerous for the carotid sinus when it's attacked, that it's possible that something breaks. Yeah, I don't know exactly. It was just I was there for vaccination, and I talked to him. It was not a real discussion, yeah? But we decided to further continue our discussion about it. But there's a little bit of risk for the elder people, especially when it's done with brute force. Yeah.
I take one thing in Swedish first of all. Karates massage används inte i Sverige, alltså på sjukhusen. Det var förut länge sedan en massage. Men det finns så mycket risker med det så att ni tänker så att ni verkligen inte utan man har andra system för att få ner det. Så ingen karates massage på den biten. Then it's also the massage I work.
Yeah, I realized that you know something about it. Yes.
And also another aspect I think also when it comes to older age, not old but older age veterans. Because with the system, with the blood system, with the flows as well, we get it's sort of with age we get the risk for
clotting,
clotting and things like that. And you don't really know always whereabouts in the body, in your bloodstream, where it is. And it's also risk, it's a higher risk when that something actually sort of pulls away and goes somewhere else. And you can stroke down.
Yeah.
And also the receptions we have here, we have them in the heart and we have them here for the blood pressure. That goes, when we're getting older, it's actually, they're not as on high alert, they're not as good as they used to be, which also means when we're standing up, when you come from standing up from your bed or lying down, from an early, I would say from 50 or 55, learn how to sit a few seconds. And then standing up from everything you do, because they are not as quick in the reactions. Yeah, and get dizzy. So what they do is that they make sure that your blood pressure from this position to this equals up, and they're not as good when we're getting older.
I actually heard from a doctor who was at this conference when they discussed if they were going to ban shime waza. And the Japanese were not for it, they were against it, and they had a presentation. It was all these reasons that you talked about, less elasticity, clothing, all this. It was like a mix with the European doctors. And the Japanese doctors, they explained that this is not, it's still quite a low risk. We only have a few older Japanese judokas dying every year from this.
Yes. This is.
And that sort of did it for the European
This is.
doctors. So it didn't go well for the Japanese.
This is the typical Japanese. We only lose 0.5%. Yeah.
I think another thing we have to realize as well, when it also comes down to children or all ages, when it comes to strangulation or Japanese blow flow, is that less oxygen to the brain causes seizure.
Yeah.
You know, so we do not want that, and that is, you know, I can't do with the referees of that, but I personally do not agree when they're not able to lift up the legs because they're not allowed to touch the judoka. Someone else should run in and do that, because we're losing the seconds, we're losing the time where the brain is actually without the oxygen in it, and without oxygen dries, we get seizures, you know, and that. So it's a reflection on it.
How many here has not made the strangulation games sitting in front of each other? I guess most of us has. Or
No.
We don't do that.
No, we have back in all
We left the 70s. Things were different then.
But the kids are doing it from TikTok and stuff.
Yeah.
Not doing it judo.
Yeah. This is very weird things. Okay, but let's bring in practice. I show you how to do it, but as soon as a partner feels some change, tap and stop. Yeah, and don't use power. Of course, this is not the position we do it in Katame no Kata, but we will implement it in Katame no Kata later. So the point is here and here. And I do Gyaku Shime because it's symmetric, and I strangle with this part of my hand. So I ensure that this is exactly in the in between, and now I twist a little bit my elbow and try to give pressure here. Comes. So and Uke should feel that a normal breath is still possible. Yeah. Here it is. Yeah. Okay. And if it doesn't work like this, so fast, then change the position a little bit. And of course, there must be a pressure on it. Yeah? Okay, please try. From the 70s. We had a referee. He was a judo pioneer, a fantastic person, but he had knee problems. Yeah? And as a referee, we all knew he has some problems to watch everything what happens on the ground. Yeah, because he could not bend forward and could not look. So when we tried to strangle, he came here and a little bit covered. Yeah. You could see. This is what we really did, and it was not very fine. So people are more fair nowadays. I think it could happen now. Okay, Julia. Now it's you have to suffer the all all five. So the yeah from the side. When we do the shime waza, first is kata shime. So here, fingers inside, and be ready to have the carotid here. Over here, and now it's kata shime now with the little finger side, yeah. Also the carotid, yeah. And she's trying to catch my elbows and push my elbows together and up. And of course, I bring my elbows to my body, yeah. And she tries to push me up, but I hook my feet in there and I strangle. This is how we do it in Katame no Kata. Yeah. So in Katame no Kata we have a defense, but the defense doesn't work. Yeah. But if I do not react and her elbows and she presses my elbows together up, this is too late for me. Now I have no chance to strangle. Yeah. So I must be in time down my elbows. Yeah. Now she wants to push me up. My head should not be on the ground, yeah, and my feet control the body. This is a kata shime. Both sides carotid we try. It's not so elegant as we did previously, but you know where to strangle. Yeah. Okay. Then we have the from behind. It's the harakajime. We have some distance and we pull back. So pulling back means sliding back a little bit. So making a little step from here, and she tries to catch my hand and pull it forward. Yeah, but doesn't work. After that, it's the ukuri erijime under the armpit here. Close, things close again, not too deep here, close, yeah, and again slide back, and this time she grips a little bit higher, yeah, to pull down my arm. Now it's almost the defense was successful. I cannot, yeah, so I must be in time, and again pull here and pull and the extra push up. So this is a kind of combined effect. And the next is kata hajime. For kata hajime, I pull up her arm and have close contact. Yeah, she tries to pull down. Yeah, but before she manages to pull down, I twist my body up and stick my hand under her behind her neck. Yeah, so I can strangle with kata hajime. So it's just a little opening, so she falls down here, but not too far, otherwise she can escape and turn around. Yeah, so my knee blocks her. And then finally, we have the Judoklubb. Yeah, here. This time, Judoklubb. Now she twists my elbows. This is her defense. Yeah, and I move to the side and I
go down, to the left, and I pull her on my body. Yeah, and she tries to avoid being pulled forward. This is what she wants to avoid. So she uses her foot to block it. Yeah, but then I simply pull down together. Yeah. Many people do the SK twisting and pushing Tori to this side, but it's only twisting. It's my action to the side, and I want to roll her over, and she blocks. She blocks here. Okay, she tries to twist. Yeah, I go here, pull her. She blocks. I finish. Yeah. That's the way of doing shime waza in Katame no Kata. Yeah? But the educational value for our shime waza is really, in my opinion, the effect on the epiglottis and on the carotid sinus. Yeah? This you can study all of these 5 techniques, and this you can implement to all other shime waza in Ranrui and to even Sankaku. You can implement this if you really understand what's happening. So in this way, Katame no Kata is a safe way of introducing shime waza. Yeah, because you have a very controlled situation. Yeah, you have a basic defense, and you have to deal with the defense. You have to break the defense. Yeah, to really strangle. Yeah, but there's not any dangerous movement. So I think the shime waza or Katame no Kata are still a relevant part of the normal judo education. Because if you teach the juniors how to strangle in Ranri or in competition, and we see the coaches on the tatami pull, yeah, it's getting dangerous. Yeah, and here they can study the fine points of shime waza. In this way, it's a safe environment, and it's they learn what's happening. And this is important, I think. Yeah? Okay. How many of you who never did Katame no Kata before? Some? Okay, so it's a lot of details about the situation, yeah? But please go together in 3 groups of 3, yeah? And practice, and one observer who gives feedback, and the others practicing and try to implement this. Yeah. If it's not the standard Katame no Kata, don't care about it. Please.
Tryck på armbågarna. Uppåt. Ja.
Egentligen går det 2 steg tillbaka. Stå, resa dig. Nu kan du sitta upp. Precis. Nu går vi bara lite. Precis. Precis. Vi kan ju det. Så man ju alltid en steg tillbaka. Så öppnar och går in igen. Klappa.
Jag ska bara klappa, okej, jag ska inte rulla med. Nej, det var nästan.
Höfterna bort.
Exakt.
When we started yesterday, the first thing I said is it can be only successful if you change something tomorrow when you start training. So what I tried to do with you is open your mind to change something for a way that hopefully turns out to be a better way than before. Yeah, a coach's course can only make sense if we do the same job on another level than before. I tried to give an answer why kata training is useful for everybody. Yeah? And the answer is for safety reasons, but some techniques. So take the kata as a toolbox, and we have safe environment for strangling waza, for sutemi waza. So we can take the examples, and we can study fine details and principles of techniques we already learned previously, or we will learn in the future, and we will fine-tune these techniques. Very little tweaks can make the techniques much more effective. Yeah? And by studying the kata has a potential for learning for us. This is another message I want to focus. There is something inside and you must discover it. Yeah? And then it has a potential to improve our understanding and our knowledge about judo techniques. And if we succeed in implementing this in our teaching methodology in the club, yeah, then we will have better educated, better developed judoka. Yeah? This is the why. Now the how. The most important part is that we are aware that uke defines the environment, the situation that tori has to adapt. So if we forget to explain the uke what to do, the tori will not have the benefit he could have. Yeah? So start with uke, and always keep in mind the relevance of uke. The second thing is we must feel judo, and we must develop a feeling for judo. Feeling is very important for a kind of self-feedback. Yeah? Because we see something, we understand something, but when we practice, we do not know if we have done what we saw previously. Yeah? So explain the uke what he should feel, and much better do some exercises so the feeling can be developed. And because feedback is important, it's a good idea to work in groups, not only kata, but also in normal technical training, with one giving feedback and the others practicing, and everybody must give feedback, so they learn the points, they learn what to observe, and they learn to communicate. This is a competence-orientated teaching. We all know judoka who can do it, but who cannot talk about it. Yeah. So from the very beginning, if you have the one person giving feedback, they learn how to communicate and how to speak about judo, and this deepens the understanding of judo, also for their own practice. Mm-hmm. And one last point is, in kata we have longer sequence which are very complex, and we must reduce the complexity to make it easier, and then step by step taking away the reduction. So we expand it step by step, and the difficulty is defined by the number of details, the amount of details, by the sequence, the length of the sequence, by what we do simultaneously, by time problems. Time problems can be dynamic. Some actions must be done very dynamic. This is difficult. Some others are very timing critical. They must be in exactly the same time. So we must deal with it. And others are critically because of physical or mentally demanding, which puts pressure, fear of failing, fear of injury. Yeah? So we must prepare, especially Uke, that he's not afraid of what's happening with him. So all this together is not only specific for kata, but all this together is important for all kind of judo, for all kind of technical development. And the traditional kata, Nagano kata, Katame no kata, are defined basically in 1906, reviewed a little bit and changed a little bit in 1960, and since then, by kata competition, there was a big and huge international exchange beginning about 15 years ago. First Kata World Championships were 2009. Yeah. Since then, there was a huge exchange, international exchange, and some people really dedicate to kata, and kata knowledge grew enormously. Yeah. So there is a kata teaching before 2009, and there is a kata teaching after 2009. And I wish everybody to have the chance to participate and to benefit from the teaching after 2009. And those who were doing kata before that, before the time, well, that was historic. Also a historic misunderstanding of kata, which were all corrected since then. Yeah? But again, the purpose of kata is not the kata itself. It's not the kata is not the purpose of kata is not demonstrating something. The purpose of kata is to deepen the understanding of judo, to improve the practical skills and knowledge, and additionally to have fun. It's a social experience with our partner. We do not have the same intensity. We have Randri and Shiai. It's a very, very special experience with our partner, and it keeps us fit and healthy. This is another very important purpose of judo. Yeah? And kata is independent from age. In Japan, there are people 80 and over who regularly practice kata. By the way, in Finland, some years ago, before COVID, there were two gentlemen from Sweden, both over 80, practicing and competing in judo kata. They were fantastic. We had so much fun together because they were so open and so much interested. Ola and I were teaching judo kata to them. It was great to watch them. Even they are 80 and they are dedicated in judo. And this is something what we think is fantastic. It's a lifelong experience. 50 years after the prime of competition, you still have something very interesting. You can, you have your experience with your partner, and it keeps you fit. There's no need to do something else but judo. And this is a journey, and I wish all of you that you decide to go in this direction, and maybe the journey just begun, yeah, but keep it going as long as you have your personal benefit of it. Yeah, and this was in short what I wanted to do with you, and I really want to thank you for this invitation, because it was something completely different to what I'm used to. Usually Ulla and I are asked to teach Juno Kata because somebody wants to improve the Juno Kata for competition, or Koshiki no Kata or something else. But here it was about something else. It was much deeper, because it's about the purpose of judo and the relevance of judo for our all judo life. Yeah, and I'm very thankful. And I've had to think about things I never thought before in this way. So I also improved a little bit of my knowledge and my insights. And yeah, thank you very much for having the chance. Yes. Thank you. Yeah.
We, of course, on behalf of our side, the university and the Swedish Judo Federation, would like to thank you for taking this challenge, coming at this time of the year, which is the busy time of the year. And actually, it's a very special day for us, because this is our last practical and our last lecture in this 4-year series of course packages that we had in cooperation with the university. And this course has been called Judo for All. And we thought that Kata as a theme was one of the themes that would fit very well into this course. And we were really thinking hard and long, who could really take this a little bit deeper perspective. Julia was the one suggesting
Okay.
I think we've all agreed that it has been an excellent choice, and we hope that it will not end with this, that maybe we can invite you back to have other themes, also the Judo Kata.
Yes.
But then here is a little, you can open it immediately. It has
Okay.
to do with this region, and this is the university colors. And
Okay. Okay, a pin. Before I open it, I put on my glasses.
Yes.
The pin? Yes. So, yes, you are very, very, very busy to close it. I have to. Okay, up. It has to do with this region. I learned in this region they have Cadillacs. It's too small for yeah. Okay. It's getting smaller and smaller. Yes. So. Yes, Julia. Yeah. It's the horse. The Trojan horse. Yeah.
And now you will see it everywhere.
Yeah. Thank you very much.
This one is a very special one because it's purple. Normally it's red or blue.
Yeah.
This is a university dollar horse.
Okay, because Julia, when she was driving me here, she showed me the big horse. Yeah. Thank you very much.
And actually, this region is the region they still produce it in old little carpentry shop.
Okay.
So if you come back another time, we'll go and visit. Maybe you can make your own horse.
Yeah. Okay. Okay. So I promise you, if you find a date. So Juno Kata, usually it's a good idea to have Ulla with me. Yeah. And maybe Juno Kata, maybe another day. So the trip is long, maybe 2 days are better than 1 day. Yeah, but we are totally open for this idea because we enjoy every time teaching. Julia knows also Ulla very well. Yeah, this would be great.
I think also because för tränarutbildningarna, I think for the education for the trainers in Sweden in generally, I think it's a good idea in a way to get another view of the kata and how to convert it in the normal. Would be good as well.
Yeah.
So thank you so much. Now it's fika.
It's yeah. Now, perfect. Yeah, fika. Fika. It's 2:30. No.
Yeah, but
Usually.
between 2:30.
You know my 10 minutes, and we have only 10 minutes delay. Okay, and fika. Yes, fika.